Good evening, everyone. It's indeed a pleasure to be discussing one of the very important topics for any medical professional, which is writing the discussion and the limitation section of a research uh, publication or a paper that you're writing, how to write the discussion and limitations. I'm Dr. Arvind Sinha from All India Institute of Medical Sciences, Jodhpur. So, medical research literature basically follows a very standardized pattern of IMRD. That is, it starts with introduction, which basically details why did you start? Why did you do the study that you did? Then it goes on to the methods, which basically tells us what did you do? How did you do it? The results basically tells the reader about what you found in the study itself, and the discussion is basically sums all these three things together and tells the reader what does this all mean, right? So what is the importance of the discussion section? As I said, it ties all the thing IMR together. It gives meaning to the study results. It gives the implications of your findings in the context of the study itself. It also is the place where the researcher can give his or her own original scientific interpretation. The hypothesis can be proposed, compares finding in the context of the existing literature. There's another portion where the strength and limitations of the study needs to be uh, detailed out in the discussion section. And obviously, in conclusion, you do a recommendation for practice or policy as far as concerned. Right. So, what are the components of a discussion? You start off, there are four basic components of discussion. It's you basically start off with what was found, right? You just get to the point, what was found. Then you discuss your key points, whatever were the key points or key findings from the result section. So you discuss the key points, what can be said about the finding. The first point, you go on to the second point, and maybe even the third point if you have them, but do not have 10 points or 20 points, right? So you discuss the key points. Then you discuss the limitations. That is what cannot be said about the paper, right? You need to use this opportunity to answer anticipated criticisms. And then you go on to conclusions and recommendations. That is, what do you make of this all study results, right? But however, I would advise all the writers, all the authors to be wary of making hyperbolic conclusions, right? As Carl Sagan elegantly put it, extraordinary claims require extraordinary evidence. If your study supports the conclusion, fine enough, make it, but do not overreach, have academic overreach and um, build bridges while actually creating what conclusions you are proposing. So, how to create a cogent, compelling argument in a discussion section? You have to go backwards. If you have to create a good discussion, write a good paper, you need to go backward. You need to start with the conclusion. You start with the why. Every author should have very clear idea of why they are writing the paper, right? If you have a very clear idea why they are writing the paper, everything else falls in the place, right? You should have the why ready that you can tell to anyone who's willing to listen in about 10 seconds why you wrote that paper, right? What I call the elevator pitch. If you can have the elevator pitch ready for the paper, you have the elevator pitch ready, you have the paper ready, right? So you have the why you're writing. Then to you need to have two or three key findings which basically support the why, right? So you should narrow the article down to two or the one or two or three key findings that narrow or lead to the why you're writing the paper, right? So why you're writing the paper, what message are you trying to give? This should be crystal clear from the beginning, first word to the last letter of the discussion section. And many papers I've reviewed have this lacuna. They do not have a clear idea of what they are trying to say, and they end up achieving nothing. So how to find the key finding? The next step could be, right? You started with the why. And how do you find the key findings? It may be obvious in retrospective studies. It may be very obvious why you started off doing a retrospective analysis of data, because you knew what the data generally is saying and why you wanted to do the retrospective analysis, right? It may be obvious. If it is not obvious, let's say in a prospective study, you need to go through the results, go through the tables and figures. Any outliers or differences are easy key points, right? If that also does not uh, stoke your imagination, then you have to go through books and literature. Read generally about four or five articles around your topic. You should have a clear idea of why you would want to write your paper, right? So some kind of immersion in the topic would be required. In your topic would be required if you want to go in to the uh, go into the article, right? So your argument should and usually will come up organically, right? You need to come up with one or two key points. Right. So how do you start writing a discussion, right? That so while you've got the why you're writing the paper, one or two key points that you've identified which support that why. Now, how do you start writing the a paper? One of the methods people follow is to set the stage, right? The first paragraph is basically used to set the stage and introduce the key questions. Right. So set stage is basically what was the basic background of the topic and introduce the key sections that needed answering from the introduction, right? Because even though it has been covered in the introduction section, people, after a few pages of reading, they might forget, right? So it is important to identify, re-emphasize the reason for the study, right? But it is very important, it is equally important to be brief, right? To not go on writing reams and reams of paper, just setting the stage and introducing the questions, right? Just be very brief. One line, few lines may be sufficient to introduce or set the stage and introduce the key question. And that could be one of the methods to start off the discussion section. Right. So let's look at this article, impact on informative videos on proxy consent by patients and in pediatric surgery, a randomized controlled trial, right? So the first line is this anxiety is compounded when you have to sign consent about something which they know very little about, have recently learned, right? This highlighted in yellow is basically setting the stage, right? The line highlighted in blue basically says a study on pediatric inguinal hernia consent found significantly lower anxiety scores in parents after a 6-minute speech video, right? This is the line where they say why the study was done. They've given the studies, which basically talks about why they did the study. Right. So it is important. Nobody wants a rambling setting of the stage or a rehash of the introduction in the discussion section. Be very brief. Alternative is just to give the key points in the first paragraph. Your key findings in the first paragraph. This might be the most direct way to get to the point, right? So let's look at another paper where percutaneous internal ring suturing for inguinal hernia repair in children. The first line highlighted in yellow orange basically said the study reports the long-term outcome of children who underwent PERS and for inguinal hernia. So this line basically says why we did this study. right? The second line goes right to the key points and they say, our results demonstrate that PERS is both safe, highly effective, and with a low recurrence rate and minimal complication, right? So these are the key points. Low recurrence rate, minimal complication for PERS is what they are trying to say, the authors are trying to say. So these are the key points, right? So you have the conclusion ready, you have the why ready, why you've written, and you have the first paragraph ready in the discussion section. What forms the body of the discussion, right? So what form? So you basically need to gently stretch to the conclusions instead of jumping to them, right? So that constitutes the body of discussion, right? So you have to basically in that you have to develop your key points further. The two or three key points which you've identified needs to be developed in that discussion body of the discussion, right? So which key point to develop first and which to develop subsequently is another question that any avid thinker might ask, right? So you generally, the rule of thumb is you generally go from general to more specific, from more simpler points to more complex point, descriptive statistics first and interpretive or analytical statistics later, right? In discussion, generally we can use adjectives and qualifiers, and this is because this is your opinion. So how to develop a point? You've identified the points, you've identified which one to tackle first, which one to tackle subsequently, but now you have to develop a point. How do you develop a point? There are four steps to developing a point, right? So first point is to describe the point, describe or state the point or result that you're highlighting, right? Just state that point, right? Second is basically step is to compare this point with the literature itself. And three is to explain why the results are what they are. And four is interpret that thing. Is that interpret your opinion or your spin on it. So let's say you've done a study on inguinal hernia repair in infancy. And you've done open hernia repairs in infant, and suppose there is the 5% incidence of scrotal edema, right? So you write, we have a 5% incidence of scrotal edema, and so that is basically the description of the point that you're trying to make. And then the second step is to compare this result with the existing literature, and the second line could well be a recent meta-analysis suggested a 6% incidence of scrotal edema. That could well be the second line. The third line is the explanation of that, and it is probably, so the next line could very well be, it's probably due to a large dissection in inguinal canal which is required. You explaining why the scrotal edema is occurring, right? And the fourth line is the interpretation, right? Fourth segment of the developing the key point is the interpretation. And it you could write it was mostly self-limiting. This is your interpretation about the key finding. So let's look at the same article that we had earlier discussed. So the first line highlighted in yellow or orange is we observed 8 complication in 6 patients with a complication rate of 0.84%. So this is basically stating the results, right? In the next line highlighted in blue, in a comparison of 1827 patients undergoing open and 478 undergoing laparoscopic repairs, Safa et al. Reported a complication rate of 5.1% and 6.9%. This segment is the comparison of your result against the existing literature. The next line that we see, which is highlighted in green, is we observed a range of complication in our patients, primarily vessel puncture. This is the exploration or the explanation of the result. And the fourth is your interpretation, which is marked in red, is only one serious complication or mental evisceration was observed. Rest, basically, the authors are trying to say we could manage it easily, right? Right. So let's go on to another example. This is another original article, or on the impact of dual coated silver nanoparticle and antibiotic sutures on wound healing in inflammatory mouse models, right? And what you can see is the authors, Dr. Weber Pandey et al., had three main key points which they developed further in one of the each of the paragraph, right? So first paragraph or first key point was challenges and innovations in suture coating. What challenges did they face? The synergistic effects and wound healing. Because they have coated both silver nanoparticle and antibiotic, what are the synergistic effects on wound healing, and what are the immunomodulatory properties of the suture itself, right? And you can see all these 3 points are funneling right into the conclusion as single points into the conclusion itself. So this is what I talk about. You started with the why, you identified the key points, and all the key points should basically lead to your why. So focus just on your key point. That's a very important point. And this one of the article which I really like is a minimally interventional approach to esophageal atresia repair with early enteral feeding is safe, optimizes neonatal outcome, and reduces resource use. Right? We should not be diverted. We should not loiter. Nigel Hall from published this paper in 2024. They had a huge series of 186 cases over 20 years with excellent results, right? If we would have been writing, we would have talked about various experience of esophageal atresia and TEF repair, like let's say maybe day of presentation, success rate, mortality rates, the birth weight of the baby, associated congenital anomalies, uh, the leak rate, the stricture rates. So we could have discussed so many points. However, Nigel Hall said basically the results speak for themselves. They are lying right in the results section. Uh, we do not need to discuss the results, right? They focused on highlighting the minimally interventional approach, right? Which they wanted to highlight was avoid chest drain, avoid routine contrast study, start oral feeds early, and avoid central catheter, right? So they did not discuss any of the points like success rate, surgical procedure, follow up, no GR rates, no long term stricture rate. It's a focused article from admission to discharge, only 10 odd references, and like King Leonidas in 300 removed everything that distracts from the throw. The authors just removed everything else that distracted from the message they were trying to give, which was the minimally interventional approach to esophageal atresia in the management, in the post-operative management, right? So they just remove everything and just aim for the why you're writing the paper. Now, coming on to the limitation section, it's a mandatory part of the discussion. It's often a tightrope walk, right? Because you are trying to identify shortcomings of your own research, right? But we should not be very careful that even though we are trying to identify the shortcomings of our own research, we should not undermine the whole study itself, right? The conclusion and your message should still be left standing after you've done criticizing it, right? This is a very important point. Do not go overboard in criticizing your own study because you would tend to undermine the study itself completely, right? It's distressing for many to write this limitation section left for the end. It's often an afterthought. Okay, let's write a few, scribble a few lines about limitations, right? It can definitely can have a detrimental effect on your paper, but we should use this limitation section, the paragraph of limitation, a little more positively, right? This is the place to answer anticipated criticisms. So your worst critics, if you imagine your worst critics, they will try to punch hole in your study, right? This is the place to answer that yes, We know these problems are there. We identify it. We call them out, and these are the things. You don't need to point them out to me. We are aware of the. Our study still stands in spite of all the lacunae that we have identified. Right. So how to identify? Uh, how to identify? We could identify in the research scope and design. Is it generalizable? Is it study design limitation? Is it RCT? Is it comparative? Any biases which may be there? Sample size may be less. So those could be in the research scope and design. In the data collection measurement used tools which are used, let's say you might be using ultrasound for diagnosing hydrocephalus, whereas the standard of care might be a CT or MRI in the Western world, so, and because of higher accuracy, and that might be a measure limitation of your study. Data completeness might be another limitation. Observer variability might be another limitation that you might identify, right? External factor like time constraint. You might have wanted to follow your patients up for, let's say, for 6 years, 10 years, but you had time constraint, you had limited follow up, research limitations might be, source limitations might be there. So those can be identified. Model assumptions like open versus lab could be identified, and threshold choices that significance 5% or 1% might be uh, uh, identified as limitation, right? So reflect. Right. So let's go on to this another article, which is an objective evaluation of intraoperative and postoperative pain in infants undergoing open inguinal hernia, and their the limitation marked in yellow is basically hence our findings may not be applicable to other methods of anesthesia. Here they have used limited generalizability as a limitation measure. Again, go on to the another example of a limitation section is they've talked about retrospective design, which is a study design kind of limitation. Uh, the thing marked in blue is basically patients and procedure numbers are low. This is a sample size kind of limitation. They relied on telephone survey. That's a methodology limitation that the authors have identified. And future area and literature gap is that the authors are saying basically that we should be focusing on prospective studies, right? But the line I want to highlight the line which is a marked and wavy line is the we report one of the longest follow-up cohorts in the literature, right? So this is the backhanded compliment that authors give to themselves so as to not undermine their study because of the limitation being identified. So this is the tightrope walking that every author has to be doing while they are writing the limitation section. They can identify the limitation, but they should not undermine the whole study itself. So, in conclusion, if I have to sum it all up, discussion is one of the most important portions of medical research. It basically reflects your thoughts and juxtaposes it against literature, right? It is critical, it is imperative to start with why. Why you writing the paper? You should have a very clear idea of why, what message are you trying to give the readers. We should be brief, only or focus on the things that you want to highlight, cut out all distractions, right? So this would make the discussion section and the paper really tight and well knit paper that basically tells a story, right? The limitation section basically answers all the anticipated criticism and it's an opportunity to answer them beforehand. But we should not go overboard. We should do the tightrope walking. And to conclude, again, we must re-emphasize the why, right? So this is in brief my thinking about how we should all write the discussion section. Right. Thank you very much. It's been an absolute pleasure talking to you. Thank you.